April is Donate Life Month. It's meant to raise awareness on organ donation, as an estimated 100,000 Americans are waiting for an organ transplant. And of that group, 90% are in need of a kidney. And here to talk more about this, we have Dr. Marquise Hart, transplant surgeon with Sharp Memorial Hospital, and Christine Brenner, kidney donor and operations and outreach lead at the Sharp Kidney Transplant Center. I want to thank you both for being here.
Thank you.
Very important topic. Let's talk about these numbers real quick. I said 100,000 Americans waiting for an organ transplant, 90% of which are kidney. Why is there such a need for a kidney, doctor?
Well, there's a large percentage of the population that has chronic kidney disease. They might not be on dialysis, but they may have a disease that progresses towards dialysis, and then they end up on a waiting list, hopefully, to get a kidney transplant.
And who is actually eligible to receive a kidney?
Well, children, adults even in their 70s are still eligible to receive a kidney transplant. We look for factors that would affect their ultimate outcome, you know, if they have severe heart disease or severe lung disease. But the vast majority of the people who have kidney disease can come in and see us, and we can evaluate them.
And I wonder, sometimes you think someone might need a kidney, and then maybe their family members might step up to the plate and say, hey, I might be able to donate a kidney. But is that difficult to match?
Even if you're not an immunologic match, if you're healthy and you have good kidney function, you can either donate to that person or donate to a list where there's a voucher. We have a voucher program so that a person may donate to someone across the country. We'll fly the kidney across the country, and then the intended recipient would then get a kidney from someplace in the United States.
And what about recovery time for both the patient and the donor?
Well, Christine can tell us more about the recovery time, but
I like how he did that.
Yes.
But okay, so Christine, why don't I ask you, first of all, you are a kidney donor. Why did you decide to do this, and when did this take place?
The transplant happened at the end of December. We got in just before the end of the year, and we did this. We were scheduled to do it in September, but then it was put off, and then so just right before the end of the year. So, but within several weeks, I was up doing my normal things. Within 6 weeks, I was on a Northern European, vacation with my husband.
So in about a month and a half, you were off to Europe.
Yes, I was on a snowmobile in northern Norway.
Oh, wow.
And so it didn't stop me at all. In fact, I only stayed one night in the hospital.
Look at that. Hold on. See, I've got questions. I know that you work for Sharp. You are the operations and outreach lead, so obviously this is a passion of yours. You decided to, you got to tell me why you decided to donate.
I'd love to. I'm a registered nurse, and I have in some way, shape, or form been in the transplant venue, where I started my career in the ICU, and then I worked with donors and donor families at the local OPO, and then I've worked in transplant, so I've also worked with the recipients. So for about 20 years, I've been watching how wonderful this process is, the benefits of the donor families, and the recipients. And I thought, I hit 60 and I'm healthy and nobody in my family needs it. And one of my coworkers, unfortunately, needed a second kidney transplant. And so I watched this wonderful, beautiful woman who takes care of our patients, and just really is very caring and kind, and now she's in that place again. So I went ahead and got worked up, and it's an honor to be able to have helped her in that way.
Doctor, when you hear stories like this, I mean, that's got to move you.
It really does. It restores your faith in humanity. You know, given the times we're in, really, Christine stepping forward like this was just like an angel dropping a kidney into her lap. You know, she wasn't doing very well on dialysis, as some patients don't, and she really needed the kidney transplant to happen within this time frame.
Wow.
And I believe Christine stayed in the hospital for 2 days after her surgery.
One night, 2 days.
It was quick.
I mean, that sounds fast. So for you, can you take us through that day?
Sure.
When you came, it was a full day, I imagine.
Oh yeah, well I got there early in the morning and I, couldn't have any coffee. So my husband drove me to the hospital drinking his coffee. And, but that was okay. He was a wonderful caregiver. And just went into the pre-anesthesia area and they got me ready, and Dr. Hart came in and said hello, and our other doctor, Dr. Kirby, and then I was off to the races. Yep. And I was a little bit, scared of, what could happen and things like that. But I literally felt so confident going in. I've known Dr. Hart for a very long time, and I know his surgical skills, and I just went in there very happy.
And then one night, so the following day, you went home.
So that night, well, I guess I was there. Was it 2? No, because the next day I went home.
And the next day you went home?
He said, you could stay one more night, and I said, no, I want to go home.
I don't blame you. Sometimes you want to be in your bed, right? Okay, real quick, before I end this interview, either one of you can answer the importance of needing donors, and maybe if people are starting to think about it, what would you say to them?
Well, I would say look within yourself and understand there are almost 100,000 people waiting for a kidney transplant and are suffering on dialysis. And I think if you would take an organ, you should think about whether you would give an organ.
Oh, there you go. Christine already did it.
If you're even thinking about it, you can call us and ask questions.
Thank you for that. So here's what I'd like to say to the folks at home who maybe want more information about what we just talked about. You can go to our website, fox5sandiego.com, click that Scene On tab. We'll have more information on organ donation with Sharp. We'll have a link there for you, and of course you can find more information there. We want to thank you both for being here.
Thank you for having us.